Well, good morning and welcome to those of you who have just joined in the last couple of moments. We are really excited about today's topic, and it looks like we're getting a big crowd. The topic is how nutritional needs change as you age. And as always, it's brought to you by a coalition of sponsors. Care Choices Hospice and Palliative Care, O'Connor Mortuary, Caring Companions at Home, and Alzheimer's Orange County. And I am Kim Bailey with Alzheimer's Orange County, and I'll be your host today. Our sponsors are wonderful, and they are dedicated to providing this monthly series of webinars to you as a service to the community, and they are always on topics that are very salient, beneficial for anyone who's working in the industry, but also all of you family caregivers as well. And I think today we'll find this information especially useful. And with that, I am very excited to tell you a little bit about our speaker. Our speaker is Kristen Gustashaw. She's worked in the field of nutrition for over 20 years, holds a master's degree in clinical nutrition, is a nutrition consultant, public speaker, and one of only 19 certified specialists in gerontological nutrition in the state of Illinois. She's a member of the Academy of Nutrition and Dietetics, Healthy Aging and Dietetics and Healthcare Communities practice groups, and is an advanced level clinical dietitian at Rush University Medical Center in Chicago. She is the lead dietitian for the CBORD Software Nutrition Operating System for the Medical Center Food System. She's a member of the Patient Menu Development Team, as well as an outpatient dietitian and media liaison for the Rush Nutrition and Wellness Center. Kristen is also a faculty member at Rush University and a member of the RUMC Integrated Cognitive Behavioral Movement Disorder Clinic, and RUMC ALS MDA Clinic, and the RUMC Epilepsy Clinic. She is the consulting wellness dietitian for the Chicago Department on Aging, providing nutrition, presentations, and private consults to older adults throughout the city. And if that's not enough, Kristen also coordinates the menu analysis for the City of Chicago Congregate Dining Program, which prepares over 1 million meals every year. She is also a member of the Illinois Department on Aging Nutrition Advisory Council Work Group. Her passion is translating complex nutrition research into usable information and presenting it, like she will today, to patients and clients, various media outlets, organizations, and at national conferences. And with that, I am very pleased to introduce you to today's speaker, Kristen Gustashaw. Hey, Kristen, I'm not hearing you. So now I do.
Can you hear me now, Kim?
It's all you.
Perfect.
It's all you now.
Welcome, everybody. Thank you so much for that introduction, Kim, and thank you for the honor of coming to speak to such a dynamic group of people. I think I could delete all of the top part of my bio and just start with that this is my passion to translate complex nutrition research into something that people can use. And I hope that's why all of you are here today. And our topic, I hope, is a dynamic one. It's a very robust topic. And if anybody did print off the materials, you'll see that I do have quite a few slides with quite a few detail. So I don't want to scare anybody. We'll keep it to time. But the most of the back pages, I like to remind people, are a bit of a user guide. So I like to try to offer resources, and I always recommend people have kind of a nutrition binder for themselves and kind of reflect on how close they're using these resources. And today's topic specifically is how nutritional needs change as you age. Now, with different disease states, they can either be hastened or really take a dive in the trajectory of these things. But in general, all of us if we're lucky enough to age, are going to see a little spattering of some of these things as we get older. And it's my job to hopefully help you all um, age as gracefully and as healthfully as possible. So we're going to kind of touch on a few different areas. What's normal aging look like? How does it affect our muscles, our bones, our eyes, our gut? How Alzheimer's plays a role in that. And this is one of those nuggets of a component where that disease can significantly progress the aging process. And with nutrition and exercise, we can hopefully slow it down. Because as we all know, there's no cure for Alzheimer's, but we do know that diet and exercise plays a dramatic role in the prevention of Alzheimer's disease and helping people age through it. And if there wasn't specific things that we could do for our bodies as we get older, I probably wouldn't have that extra certification. Okay. So some people kind of think of like aging as a dismal thing. I think it is a graceful thing um, because it's an honor I look at is aging. And I've worked with older adults my entire career. And I swear every time I've met with them, I learn more than I feel like teach them. But some of the things that we're going to talk about are age-related macular degeneration. So we do know that as we get older, we start to have some vision changes. And one of them is the macular degeneration that's directly associated with deficiencies in vitamin C and E and zinc and copper. Some of the phytochemicals like lutein, zeaxanthin, those big words. So we're going to talk about like where we can get those types of foods. Sarcopenia, if you've never heard of it, is a muscle deterioration of our lean tissue as we get older. So we're going to touch on that. Bacterial overgrowth. So we know that our gut changes as we get older. Very common. Talking about GI symptoms. I often laugh that I talk probably more about what's going out of people's bodies than what's in people's bodies from day to day, because we usually talk about our problems, not all of our successes. Osteoporosis, we are well aware that that's an aging issue in our country. Dementia, again, is very kindred to Alzheimer's disease, but we know that not all dementias are Alzheimer's. And I work in a lot of different clinics with a totally umbrella of dementia root causes. And we know that none of them yet have a cure, but we know diet is more and more coming to the forefront of being able to do things about potentially slowing that progression down and possibly even preventing some of the dementias that we see. Um, Impaired immune function, we talk about the very old and the very young having a weaker immune system, and diet is directly correlated with that. Atrophic gastritis, which some people have heard about or not, but it's an autoimmune disorder that destroys the lining of your stomach, and then therefore can uh, alter how your body is absorbing nutrients. And I think a very common one we hear about is diverticulosis or diverticulitis. And as many as 50% of people over 60 years old have diverticulosis. They have these outpouchings of their gut that may or may not cause problems, but we know it's a haven for increasing risk of a problem. And we know that diet can reduce the prevalence as well as any complications with that. Uh, Again, with somewhat of the gloom and doom of aging, and we typically have a decreased sense of smell. This is even more pronounced in Alzheimer's patients. When I was on our Alzheimer's unit at Rush University Medical Center, we would actually bake cookies and have other things baking on the unit to help stimulate appetite. This is a huge marketing tool for a lot of soap companies and scents. We know that some of the cookie companies at the malls and things would pump the smell. They'd have fans blowing it into the corridors of malls or in even outdoor malls to really entice our sense of smell. And what do we do when we smell it, especially if it's food? We want to buy it. So we know that even how you prepare foods can really enhance somebody's appetite if you're struggling with that. We have a sense, reduced hearing and vision. And a lot of people wonder, well, why is that on a nutrition slide? But we know that our senses all contribute to the strength of our appetite or the weakening of our appetite, especially the visual acuity. So, what you see in front of you really can impact whether you're going to eat it or not. And the environment and the sounds can really impact your focus. If you're being distracted, if you have potentially a dementia and your hearing is impaired, that may alter how you're going to be able to focus for that meal. Of course, mobility and coordination when we're trying to get up to the table, sit at a table using our utensils, dentition. Up to 50% of people over 65 have tooth loss, and not only tooth loss, but they have gum disease, they have ill-fitting dentures. If you have unintentional weight loss, your dentures could be rattling and causing ulcers in your mouth. And I like to think of our mouth is the first entry of any bacteria and any haven. It's like a constant open wound on your body. So what's going in your mouth and how you keep your mouth clean plays a critical role in your overall health. And it's even been associated with heart disease and keeping your mouth clean and preventing those types of problems. Flexibility, stamina, strength, incontinence. Continence plays a huge role when we talk about hydration and keeping people from being dehydrated. And then there's something called inflammaging, and it's a bit of a new immune metabolic viewpoint. So this is like a philosophy that these authors came up with, and I just love this slide, especially the slide on the right. The left side indicates how intricate our immune system is and how inflammation plays such a critical role on how our body's going to respond to our environments. And on the right, we look at what inflammation is, and that's the red bars that you see, the red line, and normal nutrition. And in this country, especially today's world, we think about overnutrition and obesity and eating too much. And you can see definitely on the right that constant overnutrition is associated with inflammation. But I think what is so jaw-dropping is that undernutrition is almost equally a cause of the same amount of inflammation in our body. And I think people are very shocked to hear that. So when we were working with people, my older adult population of today, as the decades evolve, that will change. But the current older adult, the last 20 years older adult, are more on the undernutrition side. And as you age, we'll find out it's a lot of it has to do with sarcopenia and your lack of appetite, which causes you to not eat as much and only when you're hungry. But if that happens, then you miss this zone of normal nutrition. And look at how inflammation plummets when you have a normal nutrition in your diet. So, and we're going to talk a bit about what normal nutrition is. So some of the most common changes are related to our muscles and our bones, our eyes, and our gut. And those are the top four we're going to talk about today. So this slide indicates what normal aging looks like. And you can see here on this slide, this muscle, it's a cross-section of a thigh. And this is the bone, and the red tissue is muscle, and the white is the fat. And with normal aging, you're going to have a normal decline of the amount of muscle to fat ratio. And you can see here that there's more fat and less muscle density. But with punctuated or accelerated decline, you're going to see a far greater amount of muscle loss and illness, protein malnutrition, so poor diet, insufficient energy overall, increased inflammation. So if your body's under a lot of stress, insulin resistance, these are all contributors that can accelerate that muscle loss in our body. But look how early this muscle loss starts. Lean muscle mass begins to decline after age 45. So if we're not actively trying to work against it with our diet and exercise, we are going to maybe not get to the direct punctuated decline, but you're going to fall off this normal decline. So we really want to work against it. And what goes along with that is not just the muscles you see, but it's also the cardiac and skeletal muscles that are going to waste away. And I like to always point out our heart is one of a really important muscle in our body, and we don't want that to atrophy any faster than necessary. So these are some proposed interventions. I've already talked about a couple. This is an actual X-ray MRI of a young, healthy tissue muscle, middle age, and you can see old. And again, this is disease-free. These are going to be more pronounced as aging is influenced by other diseases and medications and poor diet and exercise. So we think that a lot of it has to do with what's going on in our cells. And how do we affect ourselves? It's what we put into our body. It's the fuel we give our body, or lack of fuel we give our body, of how we're going to affect this. And this again here is another awesome slide of an x-ray. You can see the yellow is fat. The top is older male and female, and you can see how much yellow compared to red, and the bone is blue. The red is muscle, compared to our younger counterparts, where you see very little fat, a lot of muscle, and those really thick bones. So this is the ideal model we want to get to. So depending on how old you are viewing today, or who you're taking care of, or how many people in your life, the earlier you start to follow the things on these slides, the greater impact you're going to have. But I have met with 70-year-olds, 80-year-olds, 90-year-olds who we have been able to reduce that muscle loss by good diet and exercise. And why do we care if our muscles atrophy? You know, it's like, well, do I care about my appearance? Do I care about my clothes fitting? What do I really care about that lean muscle mass? And you can see that even just a 10% loss of muscle is going to cause a 10% in association with our decrease in immunity. If you lose 20%, you're talking about decreasing wounds. At 30%, you have it's harder to sit. You start to have skin breakdown, and again, your muscles are included in your lungs, so you're at increased risk of pneumonia. And then by the time you lose 40%, now we're looking at the statistics saying that it's imminent death by pneumonia because you've just deconditioned your body so much. Components of our body, both bone and muscle, go hand in hand with aging. So when we look at muscle mass decreasing, we see a direct correlation with bone loss, and then muscle strength with bone strength. So both of them in the normal aging model leads to the increased potential of a fracture. And diet and exercise can play a pivotal role in this. And this is how high of a prevalence sarcopenia is in women with osteoporotic fractures. You can see that in the yellow, this is all people. Okay, so it's about almost 1/4% of everybody. And then people without fractures, this is the prevalence of sarcopenia. And up to 70% of people over 65 with osteoporosis have never been screened and don't even know they have it. So this is a huge discrepancy as far as preventative medicine. Suffice to say that at least 1 in 7 people on this call today, or 1 in 7 out of 10 people on this call today, if you're over 65, may want to go get checked out. But it's definitely something that we should always get checked out. I say, you know, the sooner the better. Be preventative. If you don't eat a healthy diet, if you've been on a lot of medications, if they say that they can have bone issues associated with them, you don't want to take this for granted. Next slide, please. And you can see that what you look at on the left is normal bone osteopenia. So if you've ever been told you have osteopenia or heard of it, it's just a slight difference, a slight webbing of the bone. Osteoporosis when it gets much more thinner, and then severe osteoarthritis is when it just gets thinner and thinner. And I'm sure everyone in the call today has seen somebody's skeletal structure like this, and we definitely want to prevent this over time. Next slide, please. And here, just like the bone loss or muscle loss, you look at peak bone mass, just like peak muscle mass, and we're in our 30s and 40s. Okay, it's a little earlier in our 20s. This is when we kind of hit puberty and everybody gets as tall as they're going to be. The plates in our bones kind of say, okay, this is as far as I'm going. And then you can see this dramatic decline, especially in women after menopause. So we're kind of going along with men, and then there's a huge plummet of the risk and likelihood of the bone loss. So if you're not taking care of your bones pre-menopause, you're going to potentially have a much greater dive into osteoporosis. So you must be careful. Next slide, please. But the good news is that new bones are created every 7 to 10 years. Or the bad news is they're not created. But a lot of it has to do with what you do and what your choices are. So if you've not done such a good job, in the next 7 to 10 years, you can make a huge dramatic difference in the strength of your bones. And we want more osteoblasts being built and less osteoclasts. And we're going to talk about some foods that are going to help you with that. Next slide, please. So we're going to move on to aging eyes. And like I mentioned, we have a lot to cover. So a lot of these slides are going to be good reminders to you. I think eyes are more common. People hear about cataracts, macular degeneration, straight blindness, glaucomas, and all of them can be impacted by the diet that you follow. Next slide, please. And then aging gut. So we've gone through our muscles, our bones, our eyes, and our gut. And with our aging gut, most of all of my research in graduate school is with gut adaptation. And it is amazing how adaptable our guts can be. And as you age, we do start to decrease the amount of saliva we produce. We have a reduced amount of gag response, and increase intestinal tone and peristalsis all decrease. So with the pure mechanics of our gut, the way we process food starts right in our mouths with saliva. And if there's a lack of saliva in our mouth, you're not going to start that initial breakdown and digestion of food, and it's going to continue to be affected all the way down. You're not going to have the same state of peristalsis, which is kind of the squish, squish, squish of your gut. It's going to be weaker. It's going to move slower. You also have a lower esophageal sphincter weakening, which helps keep the food down. So this is why a lot of older adults start to complain of dyspepsia or indigestion. Up to 44% of people over 65 have dyspepsia. And then we talked about atrophic gastritis, which is that immune issue, autoimmune issue, and up to almost 40% of people in their 80s and 90s can have it. Between an altered enzyme productions and the increase of bacteria that can grow in your guts because of either atrophic gastritis and a reduced amount of
Okay, everybody, sorry about this technical difficulties. So the first one is the lactase secretions, and up to 70% of African Americans as they age have a reduced lactase secretion that causes them to have to alter the types of foods that they choose, and that's what we call lactose intolerant. We have an impaired immune function. Our gut is a huge haven for whether we're going to absorb the toxins and our environmental influences, whether it be it from food or environment. We have a reduced synthesis of skin vitamin D production, so we really have to rely heavily on our gut. And then we have a decreased amount of B12 absorption, primarily due to a lack of intrinsic factor, which is something that cleaves away the B12 from our protein sources. So this is one where people sometimes have to get a B12 shot. And vitamin D is becoming so much more apparently important in our bodies. There's pathways that didn't even exist in my textbooks that they're considering potentially, because of the way the gut's not really absorbing the vitamin D as much as we like, maybe considering in the future also having people get a vitamin D shot similar to the way they get a B12 shot if they're found to be deficient. So that's probably going to be something that's to come. Next slide. I'm going to try to kind of go through a little quickly because we've gotten a little behind because of technology. Oh, there's the slides. We should be on the frail gut, or frailty and incidence dementia now.
Yes.
Okay. I still see the other slide though. Are you on aging gut or
I'm on
frail?
frailty and incident dementia.
Okay, so whatever's popping up is not keeping up. So I'll just keep asking
Yeah, it's
you.
your internet connection, Kristen. It's your internet connection. I believe the audience is seeing the right slide.
Okay, fabulous. I won't belabor this much, but this again, similar to bone and muscle loss being so connected, frailty and incidence of dementia are equally connected. And what do we define frailty as is a bit vague, and we're trying to narrow it down so research can be a little bit more on the pulse with this. But it's weakness, and they test that by hand grip strength, slowness of walking speed, unintentional weight loss, low physical activity, and self-reported exhaustion. Now, on any given day, I may be considered frail, but this is a continued frail state. And you can see the black bars are with frailty, and these are all cause dementia, Alzheimer's dementia, and non-Alzheimer's dementia. And in every single case, dementia and frailty go hand in hand. And how do we prevent frailty? We have to eat a healthy diet. Next slide. We look at how sarcopenia and increased cognitive decline and impairment go hand in hand as muscles and sarcopenia advance. Next slide. And then again, this is why a dietitian's been called today, I think, because the management of cardiovascular disease associated with dementia and Alzheimer's, time and time again, goes back to the purple is all Alzheimer's, all patients with Alzheimer's disease, and the other disease listed, compared to those people with the disease but not Alzheimer's disease. And in every single case, they had a worsening of a higher prevalence of cancers and strokes and cardiovascular events, pulmonary problems in every single case. And the contributing factors to prevent these types of events go along with diet, exercise, not smoking, and maintaining your weight, avoiding diabetes, and maintaining your cholesterol. Again, what does it take to do all those things? But a low fat, low trans fat diet, low saturated fat diet coming from the wrong fats, lots of fruits and vegetables to support that brain health. Next slide. And then this is a specific slide dedicated for Alzheimer's. And we see that again, in stage 1, there's very little impairment. Stage 2, mild decline. But in stage 3, this is when we start to see a potentially direct correlation with people starting to have difficulty planning and organizing, and that's what meal prep is. When you go to stage 4, really difficult performing multi-step tasks, so they're specifically going to have direct implications of potentially how they're eating, when they're eating, and what they're eating. Next slide, please. We see that by stage 6, we start to have people be suspect or delusional. I've worked with people who start to become skeptical of what's in their food. They may tend to wander, so no longer is a plated meal going to work for them. They're going to have to transfer to potentially a finger food, kind of eating on the go idea, but it also has to be potentially altered in its texture so it's easy to chew and swallow, because by stage 7, we start to really see a significant impairment in swallowing, and our brains just not figuring out how to use those muscles in tandem anymore. This is where distraction becomes a real critical piece to avoid, because if you have distractions and you're not focusing on eating, that person is going to be much more likely to choke and have problems with aspiration. So what are our nutritional needs to prevent or to help hinder the travesties of all of those different diseases? And that's what we're going to talk about. Next slide, please. We should be on what would you take this product? And I often tease about this because it sounds like an infomercial on 2 o'clock in the morning. It's going to flush toxins out of your body and keep your organs running at peak performance. It's going to be a primary function to be controlling your blood flow to your skin, the biggest organ in your body. Strength and immune system, prevents disease, lowers your risk of infection, improves healing, and reduces muscle breakdown. And can we guess what it is? Next slide. It's just simply water and staying hydrated. Next slide, please. And this slide is really a telltale sign of how much better we need to be doing. This is the water intake of people, and from the dark blue is total population, 20 to 39-year-olds, 40 to 59, and over 60. And on the left is women, on the right is, on the left is men, on the right is women. And you can see at no age do men reach adequate water intake. And this is of all water, not just the water from a tap, not from a water bottle, but all fluids that we constitute towards your hydration. And women really only in their 40s to 60s are reaching that mark significantly. But once you hit below 60, they join the men and don't reach it. So women are doing much better overall, but we still, with that aging factor, we lose our ground. And the number one reason people were per 100,000 beneficiaries admitted to a hospital over age 76 was dehydration. It is present in over 30% of people admitted to a hospital. Time and time again, we're seeing people more and more coming into the hospital with potential fear of dementia, and lo and behold, it becomes a UTI from dehydration. So we've got to stop it. Now, the UTI may not have anything to do with the bladder. It may have to do with the brain that's causing that person to, for whatever reason, not drink the fluids. It could be an incontinence issue. But if you get a UTI, you need to really take a good look at why and how to prevent it again, because that is the most common reason people are going to the hospital. How do we combat these things we talked about today? Well, first and foremost, it's water. Water is going to help anything you are trying to accomplish in your body. It will reduce your risk of aging or your acceleration of aging, and it will dramatically improve how your body gets everything to where it needs to go. The analogy I like to use is, how far would you get if you tried to ice skate on concrete? You wouldn't get very far. You'd tear up your skates. That's what you're asking your body to do every time you stay more dehydrated than your body should be. You want it to have a well-oiled machine. It helps lubricate all your organs, but it helps get those nutrients to where they need to be. And number two, my favorite, is protein. To slow down sarcopenia, you have to have adequate protein. And this is a proposed ideal protein distribution in our body to equally spread it out throughout our meals. Now, it doesn't mean it has to be 30, but when they looked at the data, much more than 30 grams of protein at any given time, even for, closer to, very physically fit, active people, over 30, your body really can't do much with it, research shows. So you're in an anabolic phase, you're in a muscle building phase up to about 30. After 30, you start to store the extra as fat. You make your kidneys work a lot harder to get rid of the nitrogen from the protein. But much less than that, you're going to break down muscle. So you want an ideal intake of adequate protein throughout your whole day, coming along with water. And I'd like to point out that muscle holds your water. So if you have sarcopenia, you not only need the protein to help rebuild the muscle, you need the water because it's not going to be stored. Your amount of reservoir in your body is depleted. So drinking water along with your protein is a simple way to try to do both at the same time. And the next slide is something, it's just for your kind of knowledge to say this is where we get protein from. And good protein sources are your lean beefs, your skinless chickens, fish, beans, nuts. And the next slide gives you portion descriptions that you can use as kind of your cheat sheet. So avoiding direct bone loss, you must have adequate calcium. You have to avoid a vitamin D deficiency. You want to also, most people don't realize, avoid high salt and caffeine intake. You want to avoid too much alcohol, inadequate physical activity. That's one we mostly know. A low BMI, you already saw how that affects it. Body mass index, so your muscle and your fat, you want to be the right weight, not underweight. If you smoke and if you don't exercise, you're not mobile. So people that are wheelchair bound is going to dramatically affect that. Next slide. And this is just a great schematic that I love, that you can pay attention to. Just as I think pictures say a million words, and it's all those things I just listed off in a great picture form. And this slide is, again, one of those take-home slides. You kind of can absorb it after you see it a few times. And this is why sodium, protein, and caffeine, it's bad. Excess is bad for calcium. So it's going to reduce how much you're going to absorb, and you're going to get more calcium taken out of your body. And over here, you can see how we may absorb, maybe inhibited by excess calcium. So too much calcium is bad. You might start to have problems with how much phosphorus and iron and fatty acids in your body. Same thing with, fiber, phytic acid, oxalic acid. These types of things are bad for calcium. So eating a balanced diet, not in excess of anything, and avoiding supplementation. And I'd like to really, before I leave here, anything about bone health, there's more and more research saying calcium supplementation, not from food, but calcium supplementation is associated with hardening of our soft tissue, which is predominantly the main concern is our heart. So you do not want to take excess supplements. And remember that Tums is also a calcium supplement, and I've worked with patients who pop them like candy. So you really want to be careful that you're paying attention to how much calcium you are getting from your diet. These are just lists of those foods from the previous slide, so you can refer to later. You want to get about 1,200 milligrams of calcium if you can move on to the calcium and vitamin D slide. So it's about 2 ahead. Sorry, I wasn't keeping you up. I wasn't prompting you as quick. But we really would like to see most of our calcium coming from food. Upper limit is 2,500 milligrams, but this is really when we're looking at supplements. It's very, very hard to get too much in our diet, if at all. And you need vitamin D on board in your body to be able to absorb calcium. So you want to make sure you're getting enough vitamin D. We already mentioned you're not going to get much from the sun. As we get older, we don't absorb as much from the sun as depending on your climate, you're only getting it during a couple months of the year. So you really, if I were to recommend a supplement, often it's a vitamin D. If you're not getting any calcium from food, then you might want to get it from a supplement, but you want to make sure you're counting it. Next slide. Now, prunes, and I know we're talking from the California group here. Eating 5 to 6 plums or dried plums a day is extremely beneficial for aging muscle, especially for postmenopausal women. And they are loaded with nutrients to help your aging bone. But what else do we know about dried plums or prunes is that they are loaded with vitamin K. They improve, which also improves the balance of how you promote and build the muscle itself. So prunes are loaded with all these macronutrients. And next slide, they have zinc, magnesium, manganese, phosphorus, copper, boron, polyphenols, and potassium. This one little plum, this dried plum, is loaded with all of these nutrients that help specifically not only our bone, but they're really huge factors in our immune system and maintaining adequate nutrition in this one little food. So I would give it a couple of slides so you guys can go back to the importance of one food and how big of a difference it can make.
Now, before we go back to the presentation, I just wanted to let everyone know that we are going to be going over, let me get my webcam on there. Hi, everybody. We are going to be going over the usual time. So and we're hoping that all of you will stay on with us. Before I turn it back over to Kristen, though, I just want to take a second to thank our sponsors one more time. We are so grateful for the support of O'Connor Mortuary, Cure Choices Hospice and Palliative Services, as well as Caring Companions at Home. And then please do save the date for our next webinar, which is on Tuesday, December 13th. And the topic is dementia-friendly holidays, and I will be the speaker. Okay, turning it back over to you, Kristen.
Thank you. So I know we will go over, so I do want to go through these slides as efficiently as possible, which is, again, when I started the presentation. These next slides are going to be your user guide, and I want everyone to have a bit of a call to action to themselves to, after today, review these last slides after nutrition needs and really start to highlight, underline, really get these handouts used to see which of these foods am I not yet incorporating into your diet. And I am a very additive dietitian. Many people talk about what we shouldn't be eating, what we shouldn't be eating in our diet, but I focus predominantly on what are you not eating that you could incorporate into your body. And you may find that as you incorporate these better nutrients and you get a more balanced diet of adequate nutrition, the rest of your body will start to feel better. You'll have more energy. It'll be a synergistic effect to want and crave more of these good nutrients. And this slide here just tells you how much you need if you're going to be label reading and paying attention to things. Next slide. The user-friendly slide is, well, what do I eat, right? Because the slide before is the great numbers. Number crunching type people love those. But this slide here talks about just try to fill your plates with fish and legumes and eggs, whole grains, fish oil, sunflower seeds, almonds. This is how you're going to make really a healthy eye plan. And you'll see these foods are repeated on almost every one of these other slides because almonds are a great source of protein. Nuts are a great source of protein. Fish, great sources of protein for their sarcopenia. So time and time again, the citrus fruits, the berries, not only are they good in vitamin C, but they're loaded with water. So people try to make it that they feel like they have to eat a million different things. But if you start eating some key nutrients and key foods in your diet, you're going to check a lot of boxes for aging healthfully. Assisting your aging gut, next slide. The probiotics and the prebiotics, I get tons and tons of questions about these. This is what they think are going to help. They may improve your immunity. They're going to make that gut a more strong barrier to toxins and other problems. They help synthesize the vitamins in your body, reduce allergens, lower your blood pressure. There's just loads and loads of knowledge that are shown to help this. Then prebiotics, they can actually change and enhance the absorption of nutrients like calcium, iron, magnesium, and limit the survival of bad ones. So if you want to eat, take a probiotic, it's okay. But this list is just a real reminder of this is where you can get just natural pre and probiotics from your food. If people always ask me on the next slide, so we should go 2 slides. So go to the next slide, please. Sorry. This is the list of foods. And then the third slide is if you're really looking at, I'm not syndicating these particular companies, but I'm syndicating if you want to look at the types of cultures that are in them and try to get products that are similar. I always say talk to the pharmacist. Most of places will have this compares to this, like at one of your local pharmacists can help you with that. And then if you're just looking for, a really simple plan, and the Mind Diet, I threw in there at the end. It was actually developed here at Rush University Medical Center, and it's a hybrid diet that encompasses 10 things we should be eating and 5 we should be avoiding. And you'll find that we talked a bit more about micronutrients on the other slides and where we can find, boron or magnesium or vitamin K. And the DASH diet and the Mediterranean diet together created this Mind Diet, which was directly associated with a reduced risk of Alzheimer's disease. So it's not a cause and effect diet, and I put this on here because it first was associated with Alzheimer's disease and Alzheimer's prevention. And since that time, people have said, oh, this is, going to cure Alzheimer's. There's been so many confusing messages about this diet in the media. Now people are trying to make a lot of money off of books and materials that incorporate this. But what this study did was look at people over a couple years, 5 years, and they said, what were these people eating and what were these people not? And who ended up with Alzheimer's? So it's not a direct cause and effect, okay? And if they completely followed this diet, they were at a 54% reduction. Now, on this next slide that just popped up, they went on from Alzheimer's and they showed that it was excellent for cardiovascular health. It's associated with reducing Parkinson's issues. So time and time again, the more they're looking at it, they're saying this is a really good diet. And if you go to the next slide, it lists the 10 things to include and the 5 to avoid. And you can see we're seeing the beans again, the berries, the nuts, the greens, the fish, the poultry, olive oil, all the things you saw that are good for your bones, that are good for your muscles, that are good for your eyes, and they're good for your gut. The only one that didn't hit this was the dairy piece, and that we talk about yogurt. But if you want pre and probiotics, we talk about kimchi, we talk about fermented foods. So that would be in your vegetable category. And I really do hope that after today, I hope it was an information dump. I hope you're slightly overwhelmed by how many pieces and toppings we covered. But I want you to ask yourself what your caregiver role is and who you're taking care of. Are you taking care of yourself? Are you taking care of a loved one? If you're the caregiver, remember to put your oxygen mask on first and take care of yourself first, because you won't be a caregiver if you don't. And if you're a patient, trying to incorporate these things early on, trying to make these things fit in both diet related components will help you achieve these things in a simple way. So I know we have hopefully some questions, and I know my email was on the first slide, I believe. So I know because of our technical issues, we went significantly over and we kind of missed that. But I'm happy to take questions. I threw this exercise slide in here. It's not an exercise talk, but I'd be remiss to not have it there for you guys. I know YouTube is great. I know there's a million resources, but I have a hard time having a nutrition presentation without exercise. So thank you all.
Kristen, that was an amazing presentation, and you are such a pro to have to deal with all the technical glitches. I don't know what was going on today. You know, Michelle thinks it was the election. Someone else wrote in, they thought it was the rain, but for whatever reason, you delivered a powerful presentation. And yes, we have questions, so let's get right to them. All right. How effective are over-the-counter supplements like Prevagen for helping the aging brain and the ability to focus? Is it really more, is that more of a game changer than eating well?
The quick answer, I don't know how much you want me to go on this, is no. I would avoid Prevagen. I would put your efforts in diet and exercise.
That's the real game changer. Absolutely.
Yeah. You're chasing your tail with things like that.
When is muscle mass considered to be healthy?
When is muscle?
I think they were referring to slide 14. Maybe what percentage? I think they meant what percentage of muscle mass is considered to be healthy. Well,
you want to preserve as much as possible. So if they were talking about the slide where the lean muscle mass loss, it's the preservation of it. And even today, if I would have polled everybody at 18 years old, everyone would have had different muscle mass. So it's trying to preserve as much as you can and continue to build on it is the key message there.
Thank you. I had my gallbladder removed 30 years ago. I'm 70 now. What impact would nutrition have on all of that?
Well, talking about gut adaptation, your body probably forgot you ever had a gallbladder. What the gallbladder is a reservoir. So, and it releases bile that helps break down specifically fat as primarily it's tool. So when people have a gallbladder removed, they have to really significantly reduce their fat intake at first until the rest of their gut can kind of figure out how to get a better rhythm at digesting those fats. Some people's gut adapt faster and better than others, but that's the mechanism. So if you're not having any trouble now, I'd say you're great. And just focus on all of those, getting in those good nutrients.
Great, thank you. Any specific vitamin D more effective with aging? Should it be D3 or D2?
So they recommend D3 is the primary one.
Okay, and what foods have D3?
Well, that's the problem. Virtually no foods have vitamin D in them unless they're
Okay,
fortified. So in this
so we
country,
could. Mhm.
Vitamin D is fortified in our milk. We have some fortified in our cereals, and even orange juice has it. You can get it from irradiated mushrooms. You can get some from butter. But one of the craziest things, and I was a food scientist before I was a dietitian, and I don't know why yogurt is not a known source of vitamin D. I don't know why. I have to look into this of why they don't fortify our yogurts with the D like they do our dairy milk. But you can also get it from, if you're lactose intolerant or just don't like dairy, check your oat milks, your almond milks, your protein milks, nut milks. As long as they're fortified with that, typically it's going to have calcium and D with it.
Thank you, Kristen. What is the correct amount of water intake per day? What's the recommended for older adults?
We used to say, 8 glasses a day. When you really do the number on it, most of my older adults are falling in 8. It's based on weight, but it also could be based on, are you retaining fluids? But I would say if you could get to 8 to 10 cups of fluids a day, the majority of people are going to be pretty well off.
Okay. Is there an alternative for someone who is on fluid restriction for like CHF or renal failure?
A lot of times, if you're on a fluid restriction, it's potentially, and you can check with your doctors, a free water restriction. So for people like that, we really shift to your fruits and vegetables. And if you think about, if you look at a raisin or a grape, how much water, our food is laden with water. And that's a really good way, as long as it's, not a fruit or vegetable you have to avoid because of a different reason. But I've even helped people cope with their incontinence, but maintaining hydration by eating not excessive amounts of fruits and vegetables, but really focusing on, hey, what does my body need? And maybe just a little bit more because I'm not getting the water.
That makes perfect sense. We have someone who wants to know if you can give an example of what constitutes 30 grams of protein. Like, is that a chicken breast? Is that a glass of milk, or just an approximation?
I don't know what number the slide was, but on your slides in the protein section, it does break that down for you. And about, the size of a deck of cards is about 21 grams. One egg is about 1 ounce or 7 to 8 grams. So that gives you like a ballpark of, it's not a lot. A half a cup of oatmeal has 3 grams, but a half a cup of oat bran has 8 grams.
Okay.
But yeah, those numbers are spelled out for you.
Great, thank you, Kristen. I think you answered that. For those with diabetic concerns, are dried prunes, are they a good choice?
You do have to be careful because it's like eating a whole plum, and it doesn't take out the sugar. It's just a concentrated one. So when you're eating them, the recommendation of 4 to 5 a day, I'm a big proponent of carb counting, making sure you're watching that you're not eating too much carbohydrates, even good ones, at any given time. So if you're trying to get to 4 or 5 a day, I would say have them between meals as a little papa snack. Or look at, are there any other carbohydrates at that meal? And you could include 1 or 2 prunes, but check the label and making sure it meets your needs.
Okay, I'm keeping an eye on our time. We'll do a few more questions, and then audience, Kristen, as she indicated, is willing to answer questions over email should your question not be answered. What do you think of the keto diet? Do you recommend that for older adults?
So I haven't found a dramatic, I can't say benefit. It's a plausible diet for brain health. It is a very strict diet to follow. So if I did have the right candidate and they wanted to try the ketogenic diet, it would have to be done by close following of a doctor and a dietitian, because it's a nutrient poor diet, and to get the full benefit of it, you need to get your full body into ketosis. And getting in and out of ketosis could cause some neurological shifting, and depending on how frail or how cognitively impaired somebody is, you don't want to do that haphazardly. So I see that there's a place for it. I think we're going to know more and more about it. Products that are keto friendly are becoming more available, but even on the marketing side, they're very misleadingly marketed and could cause more problems than benefit if you don't do it the right way.
Thank you. By the way, you're getting lots of kudos and compliments in the chat box. We'll share those comments with you offline, but I think this is a good question to end on. How would you address an aging individual who simply has no appetite?
It's very challenging, but it's probably the number one thing that I deal with. I deal with constipation, GI issues, and I just don't have a lack of appetite. In fact, I give a whole presentation on why I eat if I'm not hungry. And we do not have an amazing sense of taste as we get older, and hydration is even worse. So the best that you can do is know that you must eat. It's not your body saying, I don't need food. It's your body misfiring on that portion of it. And with dementia, that can be extremely escalated. So if you're working with somebody who already has, is on the path of dementia, that is going to be very troubling, because sometimes they may eat, they may forget they've eaten, they may think they've eaten and they're full, but they didn't eat. I've seen so many over the decades, all of these differences. Like I mentioned about trying to have a pleasant environment, making it very appealing, very appetizing, contrasting colors helps, aromatherapy. So even putting an onion sliced and putting it in the oven just on a tray to make the room start to smell. Cooking, of course, helps make those smells really pop, but don't be afraid to stimulate it even with like baked cookies. So trying to find that, and if somebody has a food preference, trying to always give them that food preference along with healthy things, or if you can take that one food preference and make it as nutrient dense as possible. So when we talk about lack of appetite, I constantly am saying, if we can only get somebody to take 10 bites, how can we make those 10 bites the most nutritious? And maybe it's using Greek yogurt because it's, 3 times as much protein in one bite. Maybe it is adding a supplement in. But just using a tablespoon of olive oil, adding a tablespoon of olive oil to a small amount of oat bran adds 130 calories. So enhancing food so the person doesn't feel so labored and so, just all consuming about the diet is really critical.
Fabulous. Okay. Thanks again so much, Kristen. And there's still lots of questions. Again, I apologize. Time doesn't permit us to ask all of those questions, but you can reach out to Kristen via email. So this is the end, folks. We want to thank you again, Kristen, for your just absolutely excellent presentation. I'm reminding everyone that as soon as I end the webinar for everyone, your survey will pop up, and we ask that you complete that. Even if you're not getting CEs, we always appreciate the feedback. It helps us to improve our programs. We thank our sponsors once again. You see them there on the screen, and they're always there for us. Tune in next month on December 13th for some tips on dementia-friendly holidays. And also just don't forget to stay engaged with our website, www.alzoc.org, to learn about all of the other education programs that we offer. Thank you so much for tuning in today. Thank you, Kristen, and everybody stay dry if you're in the rain. Bye-bye.
Yes, thank you all.